Officially, the benefits of acupuncture for women's health is what this webinar will be covering. And let's move on to the video.
Hi, I'm Vincent Balestrino. It is my distinct pleasure to introduce Dr. Michael Beys, licensed acupuncturist and herbalist for over 20 years in women's health. I've watched Michael help countless couples start families by bringing their children into this world. Here at the clinic, his practice is holistic, drug-free, surgery-free, and he uses the body's natural ability to heal itself. Also, Michael has inspired me to go to school to learn Chinese medicine as well, and I hope to help as many people as he has. Without any further ado, Dr. Michael Beys.
Okay, thank you, Vincent, for that glowing introduction. As stated, I'm Dr. Michael Beys. I'm an acupuncturist and herbalist, and I've been practicing women's health for over 20 years. So today we're going to touch upon some subjects. We're going to talk about how acupuncture works, a little bit of some fun facts about acupuncture. Generally, in my practice, I treat a lot of fertility, and we'll talk about that, and also how conventional medicine looks at that issue. And then we'll also kind of branch out into other aspects. So by treating fertility, I've kind of branched out into other aspects of women's health, like cycles and menopause and pregnancy. And then we're going to wrap it up with some experience, some cases that I have that were particularly challenging, and share my experience with you. And then we'll open it up to some Q&A. All right. So is acupuncture for me? Yes. I have a catchphrase where I say that acupuncture treats everything from menarche to menopause. So when we start our cycles, regulating cycles early on, getting ready for pregnancy, and then can we use acupuncture for during pregnancy, of course, and then we can use it for labor and delivery, and also finally at the end of our reproductive lifespan, we can do things for menopause, and we'll talk about some other stuff as well. Now, what is acupuncture? Acupuncture, by definition, is a minimally invasive, non-pharmaceutical medical intervention. What does that mean? Basically, that means no drugs and no surgeries involved. And actually, acupuncture is thousands of years old. As a matter of fact, we've been treating women's health since 1237 AD. One of our textbooks that we use that has significant clinical relevance and also techniques, dates back to 220 before the Common Era. But what we don't realize or what we don't know is that acupuncture is part of a complete medical system called traditional Chinese medicine. And one of the other aspects that we do here is we use herbs. And herbs is a complicated subject in and of itself. So I'll just touch upon it briefly. Herbs is, I like to tell people that herbs is somewhere in between eating properly and pharmaceutical intervention, right? Herbs themselves have certain pharmaceutical and beneficial properties. Like some herbs have antibiotic and antimicrobial. Some of them increase circulation. Some of them are really good for pain. But that's one herb. What people don't know that differentiates Chinese herbal medicine from the rest is that in Chinese herbal medicine, we combine multiple herbs with multiple effects, and then we combine it with acupuncture, and it's almost like acupuncture is like a medical delivery system. We have all these great qualities of the herbs. Now we want to channel them to do certain things for specific organs and body parts. Now, I use an herbal pharmacy out of Taiwan. It's over 125 years old. They pass USDA standards for organic, and they meet all international quality control standards. Also, we have things like we have fitness in Chinese medicine. If I were to tell you that you can meditate and exercise at the same time, that would be Qigong and Tai Chi. We have a bodywork system that's similar to Shiatsu. It's called Tui Na, or what we all know as acupressure. And then we have some adjunctive therapies like moxibustion. We'll talk about that later. Cupping and gua sha. I don't know if anybody's caught that craze on TikTok where people are scraping their face with the gua sha. That's gua sha, and we'll talk about that later. All right, so is it safe? Yes, we are drilled as acupuncturists to observe universal precautions. So swabbing with alcohol, the needles themselves are sterile in the packaging. So there's minimal chance of infection. And then we never, ever, ever, ever reuse a needle. So is it painless? Instead of me explaining to you how it's painless, why don't we watch a brief video?
Typically, what we do is, if you see first, the needle is very small, you can barely see it. It's one of these are actually my pediatric needles. I use these on kids. And then we put it in the tube. The tube is critical to the insertion because it gets through the skin. If you see how it's a little bit longer than the tube, when I flick it through, right, it gets through the skin fast enough so it doesn't register as like sharp, stingy, stabby. And anything like that is not good, but anything else is okay. And then we can insert it to various depths to get, you know, the response. We're definitely trying to get a sensation. And that's the needling in a nutshell.
All right, so this is my favorite question, and I've run this a lot through my head over the years. And how does acupuncture work? It is complicated, but we like to simplify it here with a little flow chart. So the insertion of the filament creates a micro injury, right? So if we think about what happens when we cut ourselves, we don't bleed out and die. The body has the tools to heal itself. So we're basically hijacking the body's ability to heal itself. So locally, when we insert the filament, we're increasing circulation to an area. Also, we're doing things to receptors in the muscles that make the muscles kind of turn off when they're tight and spastic, or like a pinched nerve, right? We can shut that muscle off. Now that signal travels up the nerve pathway, and it blocks the pain signal in the pain pathway. The analogy is like a hot tub. Like when we go into a hot tub, it doesn't stay hot. Our body modulates that signal, and then eventually that signal gets to the brain, releases endorphins, which further relieve pain, but also kind of relax people and put them in a state of rest, like parasympathetic. And that's what I like to call and point out in acupuncture is like acupuncture is a 25-minute procedure. And that in that time, that's your time to heal, right? That we're giving the body the space and you the space for you to heal, right, in rest mode. Now, as we increase circulation, we store tissue and body and function of an organ, and then we block the pain signal and create an environment for healing, and then eventually we have a relief of symptoms. There is a fourth effect, the epigenetic effect, which helps. We've seen a lot of evidence that acupuncture turns good genes on and bad genes off, but we can talk about that another time. Now, why is it important, right? Communication in traditional Chinese medicine, especially when I'm doing it, we need to have communication between the brain and the reproductive organs, and we need a communication between the patient and the doctor. So I like to talk to people and explain to them what's going on, right? In order for everything to work properly, we have the hypothalamic pituitary ovarian axis. It's how the brain communicates with the reproductive organs, right? And the linchpin there is the pituitary gland, because the brain releases a chemical, the pituitary gland releases a hormone, and then everything can happen. But unfortunately, in today's society, we have a lot of stress. Now, we all know about emotional stress, but what people don't realize is also chemical stress, like bad diets, drinking too much coffee, medication, and then physical stress, like working out too much, or back pain and low back or neck pain and things like that. They all kind of contribute to throw off this hypothalamic pituitary ovarian axis. And then when we get stressed, we release cortisol, and then cortisol releases noradrenaline and epinephrine, which, shrinks the blood vessels and diverts the blood flow away from the brain to the muscles to fight or flight. And then it raises your heart rate, which is literally the definition of high blood pressure. So we know through acupuncture, we can release endorphins, and then endorphins actually cut down cortisol, and we can kind of reverse this negative feedback loop. Now, again, on communication, another aspect about acupuncture and herbs is that we have a procedure called the 10 questions, where we actually communicate and ask the patient questions from head to toe. And what we're trying to do is accumulate a set of symptoms and create a pattern. I like to say with acupuncture and herbs, we're trying to kill as many birds with one stone as possible. So when you trace a symptom, right, you create more problems. We want to get to the root of the problem, and the way we do that is we get a pattern or profile. And in my years of experience, I've seen two major profiles that come my way. We get a patient who has no cycle, no period, hot flashes, night sweats, anxiety, palpitation, and insomnia. That's kind of like a perimenopausal type protocol. But then we also have the patients who have an irregular cycle, like 26 to 32 days or 35 days, the period's all over the place. It's painful. There's blood, there's dark blood, there's clots, there's migraines and stress, but then there's also accessory symptoms like low back pain and knee pain. We have breakouts, we have digestive disturbances. All these things matter because it's going to determine what points we're going to choose and what herbal formulas we're going to prescribe so that we can get the period and regulate the cycle to every 28 days. Okay, so now that we've gone over some frequently asked questions, we're going to discuss some things about evidence and how acupuncture helps. All right, so why are we trying to regulate the period, right? We want to get a regular cycle. Most people say that peak fertility is on day 14. That's based on a 28-day cycle. But if you don't have a 28-day cycle, it's hard to kind of nail that down. So it's important to kind of balance these things. When we're regulating ovulation, we're basically regulating the function of the ovaries, right? We're increasing circulation to the organ itself, which then improves its function, which is to create eggs, right? And, peak fertilization. So we need to regulate the cycle. And we've seen in the evidence that through the effects of acupuncture, we can balance the fertility hormones, we can regulate how the brain communicates with the reproductive organs, and then again, increasing circulation to the organs improves the function. Also, not only that, we also see that we can improve PCOS, right, which is cysts in the ovary, which happens because of sometimes, diet-related or obesity or even too much exercise. Insulin resistance and the overproduction of testosterone throws that off and creates cysts, and we can regulate that. Now, the uterus itself is a muscle. It's a smooth muscle. We don't really control it like we do like our skeletal muscles. And just like a muscle, it can cramp and it can create problems, right? So what we do with cramps and what we've seen is by increasing circulation, you're improving the function of the uterus so that it doesn't cramp during the cycle. But also we see that it alters the structure. So if you have like fibroids, we can improve fibroids because we're increasing circulation, improving the uterus. And also endometriosis, the lining of the uterus, it inflames, it creates problems, it creates problems for fertility. Again, by increasing circulation to these areas, we can improve their function. But clinically speaking, and the evidence shows that acupuncture is more effective than over-the-counter medication long-term. Why? Because medication just chases the symptom when you have the cramps, but acupuncture has been shown to regulate the function of the organ, so long-term benefits to cramping. All right, so now, once we're pregnant, there's a lot of stuff we can do. So why don't we move it along? Once we get pregnant, there's a hormonal flux. We can develop nausea, morning sickness. Actually, there's a huge body of evidence how acupuncture helps with nausea. Also, not only for pregnancy, but due to chemotherapy as well. But as we sort of like the baby develops, it starts to take up more space. The bones start to soften, the hips start to spread. Sometimes we get carpal tunnel syndrome, but mostly sciatica. And we know that we can at least manage the pain signal, right? When you have the baby, the pain will go away. But we need some sort of relief because, frankly, it's not safe to take medication when you're pregnant, and people look for other options. And if they don't know about acupuncture, they're going to be suffering. So we do treat that. I have a very sort of specific clinical experience. Sometimes women with a smaller frame, with a big baby, takes up a lot of space, and they start to develop like a rib pain, right? And I've seen this quite a bit. And, I ask my patients, how do you manage it? I had a patient who used to, sleep in her car with the seat back, with a water bottle, pressing on it. And she's basically trying to do acupressure on herself, but she came in, we helped her out, and you know, that's definitely an option. So if you're having nausea, if you're having pain with a pregnancy, or you know somebody, definitely let them know that we can help. All right, so this is a big one. This is one of my favorites and why I like doing this presentation, because I want people to know. I get calls all the time from Facebook, and I don't know where they're coming from, but they're like, I heard that you can induce labor at 40 weeks. You know, they're running out of options, and it's like the day of, and it's like, I need this baby to come out, and there's not much I can do for you. Yes, we can move things along, and we definitely treat, and we'll do a treatment. And then, of course, when you have a baby, the first thing is to call your acupuncturist and tell them how it went. But down the road, I correspond with my patients and find out that even though they didn't go the day of, right, it did make the labor process a lot easier compared to when they didn't do acupuncture. So instead of laboring with Pitocin for like 6, 7, 8 hours, it was just a couple, and it was a lot easier. And why is that? Because when we do the acupuncture, release prostaglandins, which soften and ripen the uterus, right? When I have patients that come in early, I can kind of track and see from visit to visit, they'll actually dilate a little bit, and then they'll go, and then they won't need to be induced. But if anybody had to kind of pick a time, it's at around 37.5 weeks is a good time to start the acupuncture. And when we do the treatment actually on the table, especially with first-time moms who don't get Braxton Hicks or false labor, the body doesn't know what to do. So we can actually bring those contractions on and help the mother, move the process along. And what we see is that not only is it a pleasant process for the mother, it's also a pleasant process for the baby. It's less stressful. So it's overall a better, a pleasant experience overall. All right, just like nature, sometimes things don't go how we like them. Sometimes the baby just doesn't go into position. So we call this breech presentation or malposition of the fetus. We've treated this as well. We can get the baby to flip. There's not a lot you can do, right? It's almost like you don't have a lot of options. There's some, manual procedures, but sometimes the baby doesn't cooperate. And we're trying to avoid a C-section. So this is where we do the moxa. I'll send a patient home with moxa is basically compacted mugwort. You light it on fire, it creates a temperature of heat, and it's like a stimulus. And we stimulate the outside corner of the pinky toe in order to get the baby to move. And then when we're doing acupuncture, we can see in real time the baby moves around, right? We can see the baby moving in the belly. But I've seen some evidence in some research from the University of Palermo where they're actually measuring these results. The baby's moving, but its heart rate is staying at a good rate. It's not going too low, but we're basically getting the baby to move calmly, and hopefully in that position, the baby will actually flip and get ready to go. The good time to start that is around 35 weeks. We can start help moving. All right, so we have the baby, and then basically what I hear from the community is that you just get kind of dumped off at home with no resources. Maybe mom's not around to help, and it's an overwhelmingly stressful situation. Sometimes, like I said, like having a baby, right, is a physical stressor. Maybe we're not getting the right amount of sleep, right? That's an emotional stressor. Sometimes things don't work. But by the way, I'm just gonna add a little public service announcement here. I always recommend for my patients to breastfeed. It is the right thing to do. If you can't, that's fine. We understand people are busy, but if you have a chance, definitely breastfeed your child. But sometimes it doesn't always work. Again, delivering a baby is stressful. Being home with the baby is stressful. Sometimes, we're releasing too much cortisol. We know that the endorphins can regulate that and allows the prolactin to release so that we can produce milk, and also we can treat locally in the breast tissue to unblock the ducts as well. But for the most part, we can do a lot by treating distally. Again, right? You're at home, there's physical stressors, you just had a baby. Emotional stressors, the baby's keeping you up. Your hormones are kind of all over the place. That's a stressful situation. The cortisol kind of makes people, you see is that it throws off serotonin and dopamine, and that can lead to postpartum depression. What I like to say here is that you have options. You don't have to go through it alone. There's a huge community of support out there. You can reach out, counseling, at home help and care, but also acupuncture we know can help with postpartum depression, because again, releasing the endorphins cuts down cortisol and allows also not only for the brain chemistry to regulate, but also the hormones to bring your body back to normal. All right, so menopause, at the end of our reproductive cycle, people complain again. We talk about hot flashes, night sweats, palpitations, anxiety. The progesterone surge, when we start to withdraw from estrogen, the hormones get a little out of control. So one of the side effects is hot flashes, right? And what we've seen, the evidence there with acupuncture, it relieves hot flashes long term with good effect. Why? Because it regulates the vasomotor symptoms, right? Your blood vessels kind of constrict, they create more resistance. That's where the hot flashes come from. And we see that the effects last longer than, there's not really much help out there. You could do hormone replacement therapy, but also some patients can't do that. So there's not a lot of help, but acupuncture does help with hot flashes. Okay, so this is the bulk of my work. This is where I've seen, or I've treated a lot, is infertility. I get a lot of patients who come in for assistance of IVF. People who have gone through the IVF process have oftentimes been told that maybe they're too old, their eggs are bad, or running out of time. That's a big stressor, right? That's just huge. And then on top of it, we have family pressure. When are you going to get pregnant? Are you pregnant yet? And then I hear firsthand from patients that going to baby showers is a very stressful event. So if we're not in a good mood, then we're not in the mood. So we see that intimacy kind of takes the brunt of it. And that's just important overall. We need to introduce and bring intimacy back into the equation. Now, what does Western medicine do? Conventional medicine, we have medication, we have fertility drugs, we have IUI, where we actually artificial inseminate, we deposit the sperm into the uterus. And then we have IVF, where we take the egg out, we combine it with the sperm in a petri dish, and then we put it back in. Usually what happens is you get 3 IUIs before you move up to IVF. And then when IVF starts to fail, we have donor eggs. One of the biggest concern I hear from my patients with donor eggs is they say that, it's not my genetic material. Well, getting back to the epigenetics, we see that that's not necessarily the case, right? If we break that, everybody shares 99.9% of DNA with every other human on the planet. What we're talking about is 0.01%, right? Half of that is your husband, and then the donor. Now, what we've seen in the evidence is once the sort of embryo has been implanted, that embryo develops in the patient's uterus, and the uterus is actually contributing genetic material to development of that embryo. And it's also kind of gotten to the point where it complicates situations with surrogacy, right? It's not all cut dry, and people want to hear that. We want to kind of help our patients. Actually, at the end of the day, I don't care how you do it, how you want to get pregnant, donor egg, IVF, IUI. I'm just here to help. And then these are things that I hear. The other thing that's a complication with donor eggs is that they source a lot of eggs locally, and there's a possibility that that person or that child could be going to school with a sibling somewhere in the vicinity that they don't know about. And that's something that we have to address because people have issues with that. Now, the CDC success rate for IVF is around 40% under 35 and 11% over 35. Now, in all fairness, that is a national standard. That includes places like, down south, but places like major urban centers generally have better success rates. So it's not fair to say that that's just a number. And that IVF usually costs anywhere from $10,000 to $20,000. And if it doesn't, succeed, they tell you that with more, chances, with more procedures, you increase your chance of getting pregnant. Now, I don't usually get the cases that are starting with the initial IVF. My experience is with patients who have had 4 or 5 failed IVFs. So, it's challenging. So acupuncture with IVF, acupuncture on the day of, right? I get another call from the internet, right? I heard on Facebook that I should do acupuncture on the day of. Yes, you can do that. It's a little short-sighted. And that is, again, the numbers are all over the place, but generally the average is about 65% if you do acupuncture on the day of. What I like to do is work with my patients ahead of time before the transfer, right? We know that the dosage is important. So if we were to kind of look at numbers, more acupuncture is 60% more likely to help people compared to the people that do acupuncture on day of, right? Why? Because we're regulating a lot of things, right? The hypothalamic pituitary ovarian. So we're increasing circulation to the uterus, make it a more hospitable environment for implantation. And then we're also taking the edge off. We're taking the stress away, right? A lot of people have their day, their brain is on day 11, the day of the blood test after the transfer, and it's very stressful. We don't want to be there. We want our patients to be distracted and active, so they're not stressing out. So when I deal with these patients across the board, sometimes, even the third, the fourth, the fifth chance doesn't work. So we're doing the acupuncture, and they've kind of gone through, the medical rigor. They've gone to an ultrasound, they've seen their follicles, they've seen that they're ovulating in real time. By this point, we've kind of regulated the cycle to about 28 days, no cramps, no symptoms. So their cycle's regulated. And then they've also done an ultrasound and seen that the uterine lining is there. And then the blood test showed that their hormones kind of regulated over time. So with these factors, I try to convey to my patients that there's no reason why you can't get pregnant on your own. And oftentimes when I'm dealing with patients, they end up getting pregnant in between IVF cycles and transfers. And then the final thing that I kind of like to emphasize is we have to reintroduce the intimacy, because, despite you doing IVF, despite you doing IUI, acupuncture on your own, the body needs to kind of get cues from the brain to the reproductive organs that it's time to get pregnant, right? So that's why I kind of try to emphasize to my patients that they should be, the key takeaway is use the IVF as a backup, but try to get pregnant on your own, like reintroduce the intimacy so that they get the best results possible. One of the other downsides is even with IVF, we see a lot of times it doesn't lead to live births. We've seen that with IVF and acupuncture together, acupuncture leads to more live birth as opposed to no acupuncture alone. But we also, I treat patients who have, had frequent miscarriages despite IVF, and they call me up. And what I like to say is that, for an egg to be to develop and fertilize, it takes about 120 days. And there's like kind of unwritten rule after miscarriage, like don't try to get pregnant. 6 months, give yourself about 6 months. So in that time, what we like to do is, regulate everything, balance things out, increase circulation to the ovary, improve the function so that it can produce better eggs. But we also see that even within the eggs, they test the eggs, they see that it's a better quality egg. There's certain growth factors that lead to a better egg. And then we have some herbs, we treat with herbs as well. And generally people, get pregnant again. Now, we talked about a lot of stuff. It's very stressful. Menopause is stressful. IVF is stressful. I got some feedback from the community. They started asking me about, a lot of my patients started asking me about facial rejuvenation. So I am trained in cosmetic acupuncture. I have done it before. So we started treating, and one of the things we work on are some of the 11s. Now, if you see the first set of pictures, that's a before and after. We see the really prominent crease there, and then after the treatment we're seeing that that crease kind of goes away after the third visit. Now this is the fourth visit. What we actually do with things like that is we introduce the filament underneath the wrinkle and then within the wrinkle. And why are we doing that, right? I think if we've said anything enough, right, is that acupuncture increases circulation to an area, improves the tissue, and helps kind of fix things underlying. So by increasing circulation and improving the function of the skin itself, you end up getting a better sort of like glow or a better type of skin. So that's cosmetic acupuncture, facial acupuncture. We could do it for frown lines, we could do it for crow's feet, laugh lines, all that stuff. So now, over the course of 20 years, I've seen some pretty interesting things. So we're going to talk about a few case studies. All right. So early on in my career, we had a patient, my wife and I, and she was treating her mostly. And she came to us saying that her doctor said that she would never get pregnant. As a child, she was overweight. She became sort of like a fitness junkie. And what happened is we have this concept of exercise-induced amenorrhea, right? The testosterone goes up, it throws off the estrogen and progesterone. So she didn't really have a cycle. You know, what we did, it took a long time. She hadn't had a period in 4 years, so it took us a long time to really bring it on, but she didn't like getting no for an answer. We don't like getting no for an answer. Eventually she ended up getting pregnant. Another patient. Now this patient, she wasn't infertile. She was categorized as infertility. She had a child previously, but unfortunately she had several miscarriages, and we were treating her over time. Unfortunately, when she was pregnant, her mother unfortunately passed away. She was really stressed out about the whole situation, but she reached out to us. I think my wife kind of consoled her on the situation, and she ended up having a second child, you know, right after that, because acupuncture helps with frequent miscarriage. This particular patient came to me for the symptoms of menopause. She had not had a period. She was skipping every 2 months. She was getting hot flashes, and we were treating it. It was getting better. And in discussion, we found that, you know, she regretted not having a child. And as we were regulating her, you know, her menopausal symptoms, we actually ended up, you know, regulating her cycle, and she ended up getting pregnant unintentionally. That wasn't our intention, but because we can regulate the hypothalamic pituitary ovarian axis, people get, you know, pregnant. Okay, so now I tell people that, you know, there's certain situations, like if you hang in there and you know, keep trying, you will eventually get pregnant. And the case that I use in this situation, I had a patient who was 49 years old. She had no cervix, could not physically do acupuncture naturally. She had to do IVF, but she had failed 9 IVFs with her own eggs and 3 IVFs with donor eggs. And I was kind of at the end of my rope, and I said, you know, I don't know what I can do for you anymore. I'm trying to help. And her sort of feedback was she's not really doing the acupuncture for fertility. She's doing the acupuncture because it's making this process a lot easier for her. It's taking the stress away. So let's hear from Liz and her experience.
I started to come to see Michael after my first 2 IVF attempts that I attempted without acupuncture. And I had been told of the benefits of it, but I hadn't tried it yet. And I was already 47, but really wanted to have a baby. And I had had cervical cancer, so I had all kinds of complications. One of the things about coming here that was so wonderful was that I wasn't adding any more drugs to my regimen, and it made a huge difference in the thickness of my lining. It helped me relax. It prepared me in so many ways for a success. Here she is, 5 years old, and I had her when I was 49, and I was able to breastfeed her. My body recovered well. It was a wonderful experience. I always say to Esme that when we go to a wishing well and she wants a coin to throw in the fountain, I say she can have all of mine, because why?
She got her wish.
Because I got my wish. And what was my wish?
To have me.
Right.
So there you go. Are we okay? So stop by Google, check out the reviews, see what we're doing in real time. Now, just some closing statements. People talk about these wives' tales about, you know, oh, she adopted a baby and got pregnant. In my particular experience, I had a patient who had a child through a surrogate. And I ran into her just out at a restaurant one night, and I saw her there, and she had another baby, and she told me, she's like, I told you so, right? I kept on telling her, right? Like, once you have that first child, you know, it's going to get easier for you. And she ended up having another baby on her own without IVF, right? It's like you adopt a pet, or you get a pet, you know, and she got pregnant. You go on vacation, you're trying to bring on the period, and your period comes on vacation when you're wearing a white dress. Why? Because we're relieving the tension, we're relieving the stress, we're, you know, releasing endorphins and taking the stress away, and helping people, you know, achieve their goals. So with that being said, I'm done talking, and now I want to hear from you. If anybody has any questions, I'd like to open up the floor.